our topic that we are discussing today is navigating guidelines. I think it links quite nicely to the previous presentation. So I am with Mera Majid and Sinead Johnston.
Afternoon, everyone. So navigating guidelines, as Ben mentioned before. So we thought we'd start with a definition of what is a guideline. So a medical guideline is a document with the aim of guiding decisions and criteria regarding diagnosis, management, and treatment in specific areas of healthcare, also known as a protocol and various other names. So how are guidelines generated? So there's various routes that the guidelines we use are generated from. So some are developed locally, nationally, and then of course internationally. Sometimes they are adapted from existing guidelines, modified in small ways, large ways, depending on the specific guideline. So we can also have a committee of experts that gather existing research and modify it. So prioritization of evidence and recommendations, as well as consensus among specialists in the area.
We're just going to go into the different guidelines which we commonly use in our setting. So as my colleague previously mentioned, you can have guidelines divided nationally, regionally, internationally. So national guidelines we use commonly in our primary healthcare setting include the standard treatment guidelines and essential medicines list for South Africa. We also have the adult primary care guide, which is published by the Department of Health. Other examples which we use commonly include the ART guidelines and guidelines for STI management. In primary healthcare, this is what we would use commonly along with many others. Then in a regional scale or in a circuit scale, these are just some examples of what we are currently using in our WITS academic circuit. We have an anesthetics department guideline protocol published by WITS, and then we also have the Department of Obs and Gynae who published their own guidelines. And then just to take it to the Western Cape a bit, you have the PAC kit, which is a practical approach to care kit. That is the primary care guideline, primary healthcare, guideline, which is commonly used in the Western Cape. And then of course, we'll also have international committees who recommend what is the correct protocol and how to approach certain situations. And the WHO is a common body who is well recognized worldwide. And these are just some examples of what they would publish and what the rest of the world would follow thereafter. Okay. With the use of guidelines, many advantages arise. You can have improved consistency of care. It also offers explicit recommendations to unsure practitioners. So if people are using outdated guidelines or things which are no longer recommended, guidelines will then allow you to do the correct management thereafter. So it keeps you up to date with the most recent research, and it's most of the time it's quite evidence-based. It also assists in resource allocation, which is quite important in our setting, where we have limited resources, especially in rural areas in our clinics. So it allows us to use what we have to the best of our ability. And then of course, it's always important to protect yourself before you do anything else. And healthcare workers are also protected from liability when it comes to published guidelines, which are recognized. And then as with everything else, your guidelines also have limitations. First of all, you can have multiplicity of guidelines. This is one example, but the Barra Neonatal Handbook sometimes has something different from the EDL. So if you were looking at or comparing the two guidelines, you could be confused about what is the best course or which course of action you should take. You can also have patients who have multimorbidities. So we used COVID as an example because it's currently a developing condition under research, not very well known. So patients often come in with multiple comorbidities or they have adverse reactions, and we're not entirely sure of how exactly to manage them yet. And a treatment guideline isn't yet holistically created for such a condition. So that's where a limitation there. You can also have conflicts of interest and bias, where you have many experts and they have their own opinions. Both opinions could be correct. And then it's just a bit of a conflict on which opinion or which recommendation to go for. And then patient preferences are not always accounted for when it comes to guidelines. And as we know, in primary healthcare, our primary focus is the patient-centeredness. And therefore, you have hindrance in shared decision-making with the patient if you can't satisfy what the patient wants because your guideline is telling you to do something different and they want something different from you.
All right, so keeping in mind those limitations, so it's important when you are using a guideline, I think they are often easily accessible and easy for us to use, but to actually appraise that guideline and tell if it's a good one. These are just 3 basic points. So one is to assess the search strategy. How have they looked for research? Have they done an extensive search? Have they used really good sources? Number 2, have they highlighted any conflicts of interest? So are the names of the authors stated and have they given their conflicts of interest? And then do the recommendations make sense in your context? Are they applicable? Are they transferable? We can go deep into this. So we found this article which has pulled a whole bunch of guideline appraisal tools, and they found the most common things that all of them looked at. We thought this was quite a good resource just to see, just for your own practice when you're looking at a guideline to be able to appraise. And this is what most appraisal tools are looking at. Number 1 is the evaluation of the evidence. So have they used good evidence? Have they used randomized controlled trials? What sort of evidence have they used? And have they looked at all available evidence or all applicable evidence? The presentation of the guideline content. So how have they presented it? Have they given the context in which it should be used? Transferability. So is it a guideline that was maybe developed in Denmark and you are trying to apply it to your small clinic and discoverers? And does it actually apply? Independence. So that's again looking at the authors. Have they sort of said that they sort of work for a company that perhaps makes one of the drugs that you're using, or something like that? The scope of the guideline, so does it apply to hospitals? If they stated what context you should use it in, once again. Information retrieval, that sort of speaks to your evidence. What search strategy have they used? Consideration of different perspectives. So this is to try and limit that sort of expert bias in between 2 different people. And have they considered that there might be different opinions as well? And then dissemination, implementation, and evaluation of the guideline. That sort of goes, links in with the previous group's topic. So is the guideline accessible? Is it implementable? And have they evaluated what it is that they've done? And sort of assessed if it's worked and had the impact that they wanted it to have. So this is the COVID wards protocol for Helen Joseph Hospital. We just thought we'd use this as an example. It's not to criticize what they've done. It's just quite a good example to use just to see how to appraise a guideline. Right. So number 1, evaluation of evidence. So if you do have this, you can pull it up. They haven't given any references or search strategy. So we're unsure what evidence they've used to support it. Number 2, presentation of guideline content. So it doesn't give the context in which it should be used. It doesn't say specifically hospital patients or patients in a COVID ward or ICU patients. Yeah, but we do find it's a relatively user-friendly guideline. Transferability, in terms of if you go through the actual recommendations, they really do apply to hospital settings where you have certain drugs and resources available. Again, that might not be every hospital. So we think that there's limited transferability. Independence, they haven't stated the authors of this. And so as a result, you also can't see any conflicts of interest as a result of the guideline. The scope is narrow. I think that sort of speaks to the first 2 or 3 points as well. Information retrieval, once again, no sources or search strategy given. We don't know what their PICO questions were when they searched. They haven't given that to us. And then considerations of different perspectives. Well, we can't really tell. They haven't given us that information. But it just goes to show, I mean, this is something that I think a lot of us will be familiar with if you've worked at Helen Joseph, and many of us have used. But just to sort of be critical of things, just because something's in a guideline doesn't necessarily mean that that's the be all and end all of the evidence that we have available to us, and we shouldn't sort of push ourselves to find out more. So this is our conclusion, that guidelines can assist in diagnosis, treatment, and prevention of disease. I think in primary care, it's especially useful when you're not familiar with all the things that you're doing, or you may not be up to date on certain things. It's very helpful. They help us with management of resources as well. Useful tools in standardizing care. But yeah, we do need to acknowledge limitations, and it needs to be on you to find out, estimate your guideline, assess it, find out if you think it's worthwhile using. Cool.
Thank you. While we get the feedback from the group for your presentation, if you can just give them a rating. I just want to share some thoughts. Remember that guidelines and protocols are actually two different things. Protocols tend to be what you at an institutional level will pull from a guideline or several, and put in as a way in which for you to guide practitioners in that setting that you have, and to help them to follow guidelines. Now, it doesn't mean that it shouldn't have exactly what you've pointed out as requirements for guidelines, might not have everything, but I think it would be still good practice to have that information as to, where is this drawn from, if it is a guideline or several guidelines, and who are the authors and some of the information you've suggested. So it still could be there. But one of the biggest problems with guidelines is that you have a lot out there. Often you tend to go for national guidelines that you feel trustworthy. You need to decide how you're going to wade through them, and you've given some background. So let's just take the example of the EDL. Up until the recent electronic app, the EDL guideline actually never had any evidence. You never knew who was producing it, although it is in the public domain. So you could perhaps find out who the committee is, but the committee almost is secret, which is quite odd. And then they, they probably shared some of their interests in the committee, but it's not obvious to anyone else. But when you looked at the EDL, it didn't have any references, so you never knew where their positions came from, why they would decide what they decide. There were no arguments to say this is what we've decided to do. So I think that is a national guideline. You should expect a high level of transparency about it, and it's not there. I think in the sort of guidelines, WTO guidelines tend to be fairly clear and well supported. Some of the sort of specialist type guidelines do have good, and good indication of this information. But just understand that protocols are slightly different. So some of these books that you might pick up from different facilities, they should actually be called protocols rather than guidelines, and but they should also be justified. So thank you, well done. I think everybody found it mostly good to very good. It's been useful for you to help think through how to use guidelines, and we'll take it from there. I think the other thing is to be able to ensure that you're familiar with different discipline guidelines, and we are busy trying to collate that and make it available. But know that for you, while you function in the public service, the EDL, EML, and HIV guidelines, TB guidelines are the ones you need to keep in mind. Good. Any questions from anybody? Any comments? None. All right. Well, thank you all very much. I hope this will be useful. We'll pick it up next week. And if you can, please, the groups that are presented, please just share a case, the simple one, that we can have next week as part of a discussion in the first hour, and then we can have the presentations as usual in the second hour. Please send your case through in a Word document form, preferably to me before we meet next week. And also the presentations, if you can send it in advance,